Picture this. You wake up one morning feeling that all too familiar heaviness deep in your lower belly. You head to the bathroom, sit down, and you wait. And you wait, and nothing happens. You strain a little harder. Still nothing. You think, maybe I just need another cup of coffee. So you get up and try again an hour later. Same result. By the third or fourth attempt, something has shifted, and not in a good way. Now there's real pain, a deep, dull, almost throbbing ache that radiates from your lower back all the way down into your pelvis. You begin to feel full, bloated, almost feverish, and a quiet little voice in the back of your mind starts whispering, something is seriously wrong. If that scenario hits a little too close to home, stop whatever else you are doing and pay very close attention, because what I'm about to share could genuinely save you from a dangerous, potentially life-threatening medical emergency. My name is Dr. Franklin, and today we are having the conversation that nobody wants to have, but millions of people, especially adults over the age of 60, desperately need. Today's topic: stool that is physically stuck inside the rectum. What is it? How does it happen? What are the warning signs your body sends before it becomes catastrophic? And most importantly, what do you do about it? Right now, step by step. I promise you, by the end of this video, you're going to understand your own digestive system in a way that no doctor has ever explained, and that knowledge is going to be the most important thing you carry out of this conversation. So, take a slow breath, get comfortable, and let's get into it. Before we begin, I'd love to hear from you. Where are you watching from today? Drop your city or country in the comments below. I read every single one, and it helps me see who is part of this community. Let's start not with the solution, but with the problem itself. Most people treat digestive issues like a dripping faucet. Ignore it for a while, stick a bucket under it, hope for the best. But what we're dealing with here is not a leaky faucet. This is more like a pipe that is completely seized up. Understanding exactly why it happened is the key to both fixing it right now and making sure it never happens again. The medical term for what you are experiencing is called a fecal impaction. But forget the clinical language for a moment. In plain human terms, here is exactly what is happening inside your body. Your large intestine, that 5-foot-long tube winding through your abdominal cavity, has one very important job: absorb water from whatever passes through it. It is incredibly efficient at this job. The problem is that when stool sits inside the colon for too long without moving forward, your body doesn't know to stop extracting moisture. It just keeps pulling water out hour after hour, day after day. What begins as soft, manageable waste gradually transforms into something that has the texture and density of hardened clay. Here's the part that catches most people off guard. This situation almost never develops suddenly. It's not like a light switch flipping from fine to emergency overnight. What actually happens, especially in older adults, is a slow, gradual progression that builds over 3, 4, sometimes even 7 or 8 days. During most of that time, you may feel only mildly uncomfortable, maybe a little full, maybe slightly sluggish. You might even still be going to the bathroom, but each time you go, you're only passing a fraction of what your body needs to eliminate. A little bit gets out, but a significant portion stays behind. Think of it like trying to push a large, rough, misshapen stone through a garden hose. The stone is not going to slide. It's not going to compress. And the harder you push, the more it wedges in. That is literally the mechanical situation happening inside your lower digestive tract. The harder you strain and push on the toilet, the more you are compressing that mass further rather than dislodging it. Here's what's critically important for older adults. After the age of 60, several physiological changes happen simultaneously that dramatically increase the risk of fecal impaction. Intestinal muscle contractions naturally slow down. Pain perception in the gut becomes less reliable, meaning you may not feel urgency signals as clearly. Many seniors are on medications: blood pressure drugs, pain medications, antidepressants, iron supplements, even calcium, that significantly slow motility. The natural thirst reflex weakens with age, leading to chronic low-grade dehydration that the body doesn't even register as thirst anymore. This is not a failure of your body. It is a perfect storm of biological changes that nobody ever properly warned you about. Take a moment to tell me your name and where you're tuning in from. I genuinely want to know who I'm speaking to and supporting here. Now, let's cover the symptoms that can be deeply misleading. Getting them wrong can lead to actions that make everything dramatically worse. The first confusing symptom is watery, liquid discharge. Many people think, I'm not constipated, I actually have diarrhea. But here's the shocking truth. When a solid, rock-hard mass of stool completely blocks the rectal passage, newer, looser waste coming from higher up has nowhere to go. So it seeps around the edges as watery liquid. This is called overflow, or paradoxical diarrhea, and it tricks people into thinking they have a stomach bug rather than a blockage. The danger? People often reach for anti-diarrheal medications. These drugs slow the entire digestive system, allowing the impaction to continue hardening and growing. If you have watery discharge along with a heavy rectal fullness, do not take anti-diarrheal medication. The second confusing symptom involves the bladder. You may suddenly struggle to urinate or need to go frequently, but barely produce anything. The rectum and bladder share a confined pelvic space. When the rectum is swollen with a hardened mass, it physically compresses the bladder, making normal urination difficult. In severe cases, this becomes a medical emergency. The third symptom is lower back pain, a deep, non-specific ache that many people misattribute to muscles or arthritis. Rectal pressure can radiate into the lower back, thighs, and hips. Unexplained back discomfort alongside bowel irregularity is a red flag. The fourth symptom, especially for older adults, is sudden changes in mental clarity or confusion. This may seem strange, but bowel obstruction can contribute to what looks like a cognitive episode. Disorientation, mild confusion, or unusual agitation. This is due to systemic physical stress and, in some cases, early toxic buildup. If you haven't yet, hit subscribe now. There's much more coming that you need to know. A fecal impaction is a genuine medical emergency, not a nuisance. If left unaddressed, the consequences escalate in a predictable and serious pattern. Stage 1. Intestinal wall stretches beyond its functional capacity, reducing blood supply and muscle contractions. Stage 2. Distension spreads, affecting higher sections of the colon, causing nausea, vomiting, and visible abdominal distension. Stage 3. Bowel perforation. Contents spill into the abdominal cavity, causing life-threatening infection, peritonitis, if not treated surgically. Here's what to do right now. 1. Stop straining immediately. Straining increases pressure, irritates tissue, and risks tears. It does not move a hardened mass. 2. Lubrication and softening with glycerin suppositories. Lie on your left side, left lateral decubitus position. Apply a water-based lubricant and insert 2 to 3 suppositories. Stay still for 30-45 minutes. Repeat once if necessary. 3. If home measures fail, go to urgent care or the emergency room. Medical teams have clinical-grade enemas and imaging tools. 4. Manual disimpaction may be performed under sedation if necessary. Physicians remove the hardened stool directly to relieve pressure safely. Long-term prevention. Hydration. 6 to 8 glasses of water daily, starting with a full glass in the morning to stimulate natural bowel movement. Movement. 20-30 minutes of walking daily, gentle exercises, or stretches to stimulate intestinal muscles. Review medications. Talk to your doctor about medications that may slow motility. Avoid stimulant laxative dependency. Use only short-term, then wean under guidance. Consistent bathroom routine. Sit at the same time each morning, even if urge is mild. Posture. Use a footstool to angle knees above hips for easier evacuation. For caregivers, watch for no bowel movement for 3 or more days, abdominal pressure, lower back pain, confusion, or agitation in seniors. Early intervention is key. To recap, fecal impaction is a serious condition that develops gradually, disguises itself with confusing symptoms, and can escalate quickly. Warning signs: persistent rectal heaviness, difficulty passing stool, overflow liquid discharge, difficulty urinating, lower back pain, and unexplained confusion. Emergency protocol. Stop straining, use suppositories properly, repeat if necessary, seek urgent care if unresolved. Long-term. Prioritize hydration, movement, medication review, consistent routines, and posture. Your digestive health is deeply connected to energy, immunity, mental clarity, and overall quality of life. It is consistently neglected, often due to embarrassment. Now you have the knowledge to act. If this video helped, please like, share, and comment. Subscribe for more straightforward senior health education. Take good care of yourself and drink your water.